Are you there?
Hi, everyone. This is Janet Hill with the Rock Island County Health Department. Thanks for joining us. Sorry for the small wait while we were experiencing some technical difficulties. Today, we have with us Nita Ludwig of the Rock Island County Health Department, Edward Rivers of the Scott County Health Department, and Dr. Louis Katz, the Medical Director of the Scott County Health Department. First of all, Nita, let's start with some Rock Island County numbers, please.
Sure. Today in Rock Island County, we have 25 new cases of COVID-19 for a total of 12,112. We are reporting one death of a man in his 60s who was hospitalized. And our total deaths to date is now 293. And again, we offer our condolences to this person's family and loved ones. We do also have 28 people hospitalized in Rock Island County with COVID-19.
In Scott County, the number of cases today is reported to be 16,081. Our deaths at 173. That's an increase of one community member who we lost to this disease. Our sympathies go out to their families and friends.
As you know by now, this week's snowstorm forced the postponement of last Tuesday's mass vaccination clinic at the Greater Quad City Auto Auction in Milan. All 600 people who were registered for a time slot last week will be vaccinated at the February 2nd clinic in the same time slot. In addition, we received another allocation from the state, so we are adding 175 slots to the next week's clinic. In all, we expect to vaccinate 800 people on Tuesday between 9 a.m. and 2 p.m. The link to register for the additional 175 slots will go live at 10 a.m. on tomorrow, Friday, on our Facebook page and on our website, www.richd.org. We are using Sign Up Genius for the slots. You do not need to sign up for an account with Sign Up Genius. Just click a slot that's open and put your name and email address and click Submit. We do expect these 175 additional slots will go very quickly, just as the first ones had. We also are working out the final details of an indoor backup site in case we can't do our drive-through clinic due to inclement weather. We will announce any changes and site location through our media partners and our Facebook page and on our website. We will continue the drive-through clinics whenever the weather allows. Drive-through clinics are safer because people aren't gathering indoors during a pandemic. And until just this week, gatherings of more than 10 people were not allowed under the restored Illinois mitigations. We are also working with a local social service agency to register Rock Island County residents who do not have access to a computer. Please stay tuned for more information in the coming weeks on that. We must remind everyone that vaccine supply coming into the county remains very low, but the number of ways to be vaccinated is growing. Appointments through our partners also remain limited because of the number of small vaccine available. Here are the ways to register for vaccine in Rock Island County. Rock Island County Health Department link, which goes live at 10 a.m. every Friday on our Facebook page and on our website, richd.org. Also at Hy-Vee.com, Walgreens.com, Jewel Osco Pharmacy, which is Albertsons.com. And Community Healthcare has an email that is covidvaccine@chcqca.org. And after you email them, they will give you further instructions on signing up for an appointment. The federal government has said the vaccine supply will increase in the coming weeks and months, but until then, we ask you remain patient and wait your turn. It will come. Thank you.
We appreciate the patience of our community as we've navigated the planning and implementation of a community-wide vaccination campaign. You've heard it say it time and time again, but the limited vaccine supply has been the most single difficult factor in scheduling clinics for priority groups in these first two phases. February 1, Iowa will move into phase 1B of the vaccination priority phases. With this, we will begin vaccinating two groups, persons 65 years of and older, and phase 1B, tier 1 employees. Our first vaccination clinic, first public vaccination clinic, will be for persons in the 65 plus priority group. It will take place on Monday, February 1st from 10 a.m. to 3 p.m. Scheduling an appointment is required. Walk-ins will not be accepted. Registration will be available tomorrow on our website, scottcountyiowa.gov/health. The clinic will take place at the former Sears department store at North Park Mall. The primary way to schedule for this clinic will be via that scheduling link on our website. However, we recognize that internet registration is not possible for everyone, and we want to ensure that members of our senior community have scheduling resources available to them. Therefore, we are partnering with the Center for Active Seniors Incorporated, CASI, to assist in registering those seniors who need extra help. Seniors needing this assistance are asked to call CASI at 563-386-7477. We'd like to stress that this is the first of what we expect to be many public clinics serving the 65 plus population. Additional clinics will be scheduled weekly based on the vaccine supply given to us. Everyone will not be vaccinated during the first clinic or perhaps even during the first few weeks. However, we are committed to continuing this process in the upcoming weeks and months. Next week, we, along with our healthcare partners, will also begin vaccinating groups in phase 1B, tier 1, including pre-K to grade 12 school staff. The vaccination of these groups will take place by working directly with our public school districts and non-public schools. School staff do not need to contact our department for appointments. We know our first public vaccination clinic is a welcome sign for many in our community, but we know this will also cause frustration due to the limited supply of vaccine and limited number of appointments. Again, as more vaccine is available each week, we will continue to schedule clinics. We encourage everyone to find information on vaccination clinics and what to expect on our website at scottcountyiowa.gov/health.
Thank you. And joining us today, we do have Dr. Louis Katz, the medical director for the Scott County Health Department, who will talk to us about a number of emerging issues within COVID-19. Please go ahead, Dr. Katz.
Well, I thought it was only the issue of variants, but I'll wing it if there's more. So a lot of news recently about mutants of the virus that are circulating worldwide and finding their way to the United States. Changes in the genetic makeup of these viruses, variants, they're called, are expected, especially with RNA viruses, of which coronavirus is an example. These have been major barriers to effective prevention and treatment for infections like HIV, the AIDS virus, and hepatitis C. Coronaviruses are no exception, but are considerably slower to evolve this way for reasons that are well understood that I'm not going to get into. Perhaps half as fast as the flu, and maybe 1/4 as fast as HIV variants emerge. So since the start of the epidemic, there are thousands of SARS-CoV-2 variants worldwide. This is all totally expected. Obviously, the very large majority of these changes have no measurable effect on how the viruses are transmitted or how sick they make people. There are new variants now, late in the pandemic, from the United Kingdom, South Africa, and Brazil that are causing an enormous amount of both scientific, media, and population concern. The reason for the concern is primarily because of reasonable evidence, not solid evidence, but very reasonable evidence that they are transmitted more easily from person to person than what we call the wild type of the virus that has been circulating since spring. Early estimates on this increase in transmissibility are from a third to half more transmissible. And of course, this can make it more difficult to achieve herd immunity if the viruses transmit more easily. These changes in the virus involve a structure called the spike protein, and it's the spike protein that's used in vaccines for our key, one of our key preventive approaches. So whether they will affect vaccines is very important to know. The other issue is whether people infected earlier in the pandemic with wild type strains will be reinfectable by the variants. All this work is ongoing at a feverish pace in public health and academic laboratories. And that data will evolve very quickly over a period of weeks and months. There is no credible evidence yet that any of the variants that are circulating, particularly the three that I mentioned, cause more severe disease than wild type. So they look more transmissible. Whether they cause any difference in the disease pattern really isn't clear yet. In the United States, the United Kingdom, Great Britain variant is present in 28 or more states, 28 as of this morning, and I haven't looked since very early to look for other reports. Of some importance, none have been recognized in Iowa, and the laboratory at the State Hygienic Lab is capable of finding those variants. So we haven't seen it yet, and a lot of testing going on at the state lab that I suspect would identify it if it was present. Has been seen in Illinois. The South African variant was recognized today in 2 people in South Carolina who had no travel history. So that suggests that community spread accounts for those 2 infections in South Carolina. The Brazil variant has been seen in a single report in Minnesota, none in Iowa or Illinois. Very early data from the vaccine manufacturers suggests there may be slightly lower levels of antibodies raised by some of the vaccines to some of these variants. There is absolutely no evidence that these measurable differences are enough to reduce vaccine effectiveness. I say that again. These are slightly lower levels of antibodies, but I would be surprised if they significantly affected the effectiveness of the vaccines. There are drawbacks to these studies, mainly that they're being done in test tubes and not in people, and the number of variant strains that have been tested remains a little bit limited at this early date. More important data will come from clinical outcomes in large numbers of immunized people. So if we see vaccine failures and they are disproportionately with variant viruses, we'll get an early indication that these viruses may be an issue with vaccines. As I said, the manufacturers, academic and public health researchers are working feverishly to answer these questions. The other issue that we'll address fairly quickly with epidemiologic data is if the vaccines being brought forward are behaving differently in the UK, South Africa, and Brazil, where the variants are common, in comparison to their performance in the US, where they remain relatively uncommon. So pay attention closely, and we'll be updating that data. The media will be covering this data, I'm sure quite breathlessly, over the next days, weeks, and months. At the same time, the manufacturers are looking at what they might be able to do to rapidly reformulate their vaccines to address the variants if it becomes necessary. One of the advantages of the two messenger RNA, mRNA vaccines that are available at this time is that they are quite easy to reformulate. And what we will need is a cooperative FDA to hasten regulatory clearances if it becomes necessary to reformulate the vaccines. So that's all I wanted to say, and I can take questions, or we can address other issues if there are those.
Okay, thank you, Dr. Katz. I know we have a couple questions, some of which you've addressed. In regards to the strains, I think you did mention that one of them has been found in Illinois. Can you repeat which one and just the details of that you know?
That's the UK variant, I suspect it is more transmissible. I'm not sure. There's absolutely no evidence that it causes a different disease. So this will evolve over the next several weeks, and we'll know the answer. I think that increased transmissibility brings up an issue that I should have covered in my prepared thoughts, and that is the circulation of these variants means it is time to double down on our non-pharmaceutical interventions: masking, social and physical distancing, hand hygiene, and appropriate cleaning of the environment. That is the best way at this point, when vaccines are very short, to prevent widespread dissemination of these variants.
Okay, Nita, I do have a question for you here. I'll wait till you jump on. It says media info from the state and county level in Illinois has indicated Hy-Vee and various drugstores had the vaccine starting Wednesday, but a number of readers claim they were told no vaccine was available. Can you just expand if this is a supply issue or what people should be doing?
Sure. So the vaccine that is going to the Hy-Vee pharmacies does not come through the local health department. So I cannot really speak to when they got vaccine or how much vaccine they got, but I can tell you that vaccine allocations do remain very low right now. So it is very limited. And when they do have appointments, they do fill up very, very fast. And then they won't have any until the following week's allocation.
Nita, another question, and perhaps Dr. Katz can expand a little bit on it after you answer for Illinois. Governor Pritzker says the state will try to get a 6th dose from the Pfizer vaccine vials with the use of special syringes. Will these be used locally in regards to what you guys are doing? And then maybe we could just discuss how those syringes work.
Sure. So yes, Dr. Katz can explain better about the syringes, but that has been stated in Illinois. And when we get vaccine allocations, we also get the ancillary supplies along with the vaccine. So if we do get those syringes, they will come with our ancillary supplies like the gloves and masks and face shields that they've been sending along with vaccine.
Dr. Katz, do you want to explain? I know there have been a couple of news stories on that, the types of syringes. Is it like a no-waste syringe?
I don't know why a special syringe would be required. You just need one more. When these vials are filled, in order to be certain they don't underfill, they overfill a little. And so often there's an extra dose of the vaccine, any syringe that can enter a standard vial will do it. So I suspect if they're talking about special syringes, it has to do with packing an extra syringe with the ancillary supplies. I can't imagine why you need a special syringe. Somebody can explain it to me if they know.
I read an article yesterday about the issue. They're using what they call a low headspace syringe, where it leaves the absolute minimum amount in the hub and needle after administration. So 1 cc syringe with a 25 gauge needle. And the article indicated that because of their use in trying to get reliably the extra dose out of the vials, that they were currently in short supply.
Well, I think we can probably handle this and have been at our site by being careful when we draw it up. That's fine, but we won't be wasting vaccine if we don't have special syringes, because we're very careful. I don't know if Amy's on, she can discuss that, or Roma, but I don't think they are.
Yeah, I don't think they were able to join us today.
Yeah.
I don't see additional questions at the moment. I know on behalf of both health departments, we'd appreciate our media partners on the call helping us to share that message of patience. The supply remains low. However, we're committed to continuing to provide clinics to get as much vaccine out into the community as we can, and we will continue doing that based on the allocations we are given each week and how much we are able to provide in those clinic slots. So please be
Hey,
watching.
Brooke.
Oh, you had some
I'm
additional
sorry, this is
questions.
Janet.
Go ahead, Janet. Yes.
We have a couple of early questions. We answered many of them during Nita's talking points. But if an older person who is not tech savvy can't get on the Sign Up Genius, what options are we looking at this point, Nita, to help older residents who have concerns about the online option?
Sure. Right now it is online options for all of those different methods, whether it's from the health department, Jewel Osco, or Hy-Vee. So we do realize that there are some issues with that. Some people do not have internet, and we are working with a local social service agency. We do hope to provide some extra help for those individuals, but it's going to take about a week or so for them to get set up. And once we have that information, we'll be passing it along as soon as we can.
Okay. If someone has gotten their first dose at the Milan drive-through clinic, how do they get their second dose?
Right. Well, that's been the question of a lot of folks, and I certainly understand that. We do have that additional 42 days, according to the CDC, to get that second dose in. So that does help people. You do have a little bit of leeway time. And we are scheduling every other week of the Milan site to be second dose clinics. So we primarily will be do second dose at those weeks. And then as Hy-Vee and Jewel Osco have more vaccine available to them, they will be able to help us. Right now, Hy-Vee will do second doses no matter where people got their first dose. And we are working to get Jewel Osco on board with that too. We did not know that, but when we had referred people to Osco, their system would not let anyone sign up for a second dose unless they received their first dose there. We are working with the corporate office out of Chicago, and we hope to get that fixed.
Okay. This is a unique situation to our bi-state community, that a lot of people live in one state and work in another. Where should they get their vaccine?
Well, they can really get their vaccine depending on if they're in whichever phase they are for Illinois or Iowa. You know, we have that a lot. So in Illinois, if someone lives in Iowa, but they work at Trinity, Genesis, or one of the critical infrastructure phase 1B professions, they can get vaccinated at one of our clinics in Illinois.
And they would be required at the vaccination site to show their work ID or proof of employment or their driver's license, correct?
Yes, we really just need something to show that they are eligible for vaccine in phase 1A or 1B.
another question is, if people can't get through online, does that mean that the clinic is full?
Yes, that is what it means. I think we have said before that first 600 slots went in about 4 minutes. So we do expect these additional 175 that we're opening up tomorrow will go very fast as well. And the same with the Hy-Vee appointments. I believe they filled up very fast too.
And then are there other plans to have mass vaccination clinics like the one in Milan at perhaps other days or other locations?
Right now, the vaccine supply is so low that we couldn't have other days or other sites going at the moment. But there are certainly plans to review that and open as we move along and vaccine becomes more plentiful. We are doing Tuesdays. Community healthcare is doing Saturdays and Sundays, and the pharmacies will do any of those days of the week when they have vaccine.
Okay, and since we were talking, there was one additional question that went into the chat that is more appropriate for Nita. Governor Pritzker has talked about the vaccine hesitancy among the public. Do you see that locally, and how are you trying to reach out to minority communities?
Well, we haven't quite seen that locally yet because it seems that everybody wants vaccine right now, and we don't have enough to vaccinate everybody that wants it. But yes, statewide and I believe nationwide, everyone is seeing that hesitancy among certain groups. We do have some local leaders that I believe are speaking tonight. And Janet, you can talk about that. I know you had been part of planning that, and Brooke as well. But we do hope to reach out to the other communities and all the various groups in our community. We highly encourage everyone to be vaccinated when they have the opportunity.
And the event that Nita is talking about is an online forum from 6 to 7 p.m. sponsored by a number of community organizations, including the NAACP on both sides of the river. There is information on the Rock Island County Health Department's Facebook page. We will be live broadcasting that link tonight, and you also can get it on the NAACP site. Any place else, Brooke?
It will be hosted live on the WVIK Facebook page. So they are helping with the technology for that. So that can also be found on there, as well as the Scott County Health Department's Facebook Live, as we share from theirs as well.
Okay. Well, thank you everyone for joining us. We expect to come back to you on Tuesday. Thank you so much.